Well, welcome everybody to this closing plenary of the Global Digital Health Forum. I'm absolutely thrilled that you've been able to join us, technical or non-technical issues, and we have a fantastic panel for you in this closing session. Now, what we're going to be doing is looking at the role that tech, digital, and social media platforms can play in harnessing their unique expertise that we've begun to experience in the 21st century to inform, to educate, to save lives. That obviously applies to COVID, but it's much, much more than COVID. So, as I said, my name is Ben Plumley. I am from the Bay Area Global Health Alliance, which is thrilled to be able to support this event with our executive director, Sarah Anderson, who I know is in the audience today. I'm also the host of the podcast, A Shot in the Arm podcast, and this wonderful session will be released as a podcast after this is released. So let me ask you first of all to welcome the guests that we have on this panel. I want to say hello to Andy Patterson, who is the team lead, digital channels at the World Health Organization. Heidi Larson, who is the founder and director of the Vaccine Confidence Project and professor of anthropology, the London School of Hygiene and Tropical Medicine. Praveen Raja, who is head of health innovation and partnerships at Facebook. I see I'm just getting a message to say there may be a problem with my microphone. Can anyone hear me, and am I still coming across okay? Well, I'm going to assume that's a yes. As well as Heidi, we have Praveen Raja, the head of health innovation and partnerships at Facebook. We have Rachel Simbande, who is the program director, Data for Development Digital Impact Alliance, DIAL. And finally, and by no means least, my very good friend, Hema Budhi, who is the director of product management at Google. Welcome everybody to this plenary session. Now, the way we're going to handle this is that I'm going to ask some introductory questions of our panelists, which will give them an entry point to get their views and their remarks out. And if I may, Andy, I would like to start with you. And I guess the question is, how has the World Health Organization, not exactly shy of the press this year, but how have you been working with partners, including the tech community, not only to address infodemics, but to maximize the collaboration with social networks and digital media to reach populations and promote real behavior change?
Oh, thank you, Ben. Before I start, I want to say what an honor and a privilege it is to be here today in such wonderful company. And before I go into the answering your question, I'll just tell you a little bit about what I see my job as being. So I see my job as getting more health messages into more people's lives through as many channels as possible. And obviously, what we're trying to do at the World Health Organization is to allow them to make better health decisions so they can live healthier lives. And at the moment, that means saving lives, obviously, and trying to bring this pandemic to an end as soon as possible. So how do we do this? Well, we could spend millions of dollars and a lot of effort trying to drag people into our channels. What my team has done is turned this on its head and said, why change someone's digital behavior? Why don't we try and get into their channels that they have on their lives? So I'm probably writing, assuming that most people listening to this today are working from home or in an office capacity in very limited spaces. But try and think back to when you were going to the office every day and think about your journey to work, your travel to the office. So you'd get in the same car, you'd go along the same roads, and you'd go to the same car park, probably. You'd get annoyed at the same bottlenecks on the journey, or you'd get the same train, or you'd walk. And it's very hard to change that behavior in people. Trying to get somebody who's in a car to get on a train, or trying to get somebody in a train to get on a car, or take a different road is very difficult. So this is the approach my team has had, is to say, how do we get into people's digital journeys and digital lives? You may know that on the average mobile phone, you have 30 apps, but actually on a daily basis, you only use 4. My job is to get into the 4 on your phone. So the way we collaborate with the tech industry, whether it's the digital platforms or the social media platforms, we sort of paint the problem definition to sort of say, WHO, this is what we're trying to achieve at the moment. This is our audience we're trying to reach, and these are the messages we're trying to get to people. And we would like the tech industry to offer solutions definition. So we do the problems and they do the solutions. And usually where the two overlap, that's the sweet spot in which we try and work. And we try and work on three different pillars of work. The first is that we raise good content. We want to raise good content because misinformation will thrive in a vacuum, right? So we have to get good, credible, science-based information into people's lives. The second channel is we fight misinformation. And the third is we look at user insights and create new tools and new channels. I'll give you a quick example of each one of those pillars so that you get an idea of what we're doing. If you go to google.com now, and do a search for coronavirus, COVID-19, or one of 30 related search terms, you will get an experience that Google Search and the World Health Organization has worked together to create for you. We want to have our users to have a healthier journey. So what we have done is we've been able to raise global content with regards to the disease itself, the symptoms and things like that, which don't change in every country. But WHO is also very aware that the local user would like local information. So we're also giving them the latest information from the Ministry of Health. So on the West Coast today, since a lot of my colleagues on this call are from the West Coast today, you would have information from CDC, you would get numbers that are relevant to you, and you'd get news that's been curated and that's relevant to you. And that's one of the perfect examples of how we have managed to get and fight misinformation, to get good content raised and to fight misinformation in Google Search. Google Search, as you know, is trillions of search terms per year, and we're extremely proud of this collaboration. Another perfect example of the work we've done is with Facebook, and it's great to see Praveen on the call today. We've provided a lot of content and a lot of advice to the COVID Information Center, which has been surfaced to 2.2 billion people through Facebook. With regards to fighting misinformation, this is some of the work that I'm most proud of because it has the biggest impact. It's a bit of a slower burner, but what we have done is we've worked with especially social media companies on working on their policies, trying to improve their policies and make them more robust. No social media platform wants to be the judge, the jury, and the executioner. So we try and help them be the judge and try and inform them to make their policies more robust. Good examples of this would be some of the changes which you may have seen at YouTube, where if it doesn't fall into public health guidance from the CDC or WHO, it won't go on the site. Some other policy changes which have had a really big impact in things like harm to human and redefining what that means. It doesn't mean just a threat, a personal to person threat, but also misinformation can fall to humans. So again, working with the policy teams. Third channel, very briefly, user insights, because WHO is an evidence-based organization is based on science. We're desperate to get good user insights into behavior, looking for what people are searching, what is worrying them. Okay. The difficulty is measuring that behavior change in the field. So in the future, we'll have to look at how we do randomized controlled trials.
Well, Andy, I think, thank you very much. I'm thinking that your presentation finished fairly rapidly, but thank you very much indeed. It's just wonderful, isn't it, to see the WHO back and really making a contribution in the way that we've always known that it would do. Now, we'll have a chance to put questions to Andy and colleagues later on in this session. But I'd now like to turn to Heidi Larson, who is really an extraordinary person and someone who has, I think, really come into her own as a global leader this year, particularly in the age of COVID. Now, Heidi, as we know, has been working on vaccine confidence really for over a decade, 2 decades almost, and has some unique insights into not only how we fight misinformation, but how we engage people who are concerned or perhaps hesitant about the kind of information about science generally that they're getting across the board. And so, Heidi, first of all, welcome to this panel. Um, but I guess the big question for you is, what is your experience in working with folks who perhaps are at the fringes of concerns about the accuracy of science, and how can we engage them in a more positive way that doesn't just shame or dismiss the concerns that they have?
Ben, I think that's a good transition from Andy. I think where he was failing, just technically, his insights. Let's pick it up here because really, it's really about listening. And I think that there's a lot. I mean, the public health, it's important to be putting out a lot of information that's important. But it's not relevant to what publics are asking. And I think that the evening piece is important to address and actually around these information. The first things I do when I'm confronted with someone different view, I try to find a place where we agree, and there's something you can agree on. I've never with some of the more difficult, strong points. There's always something on, and sometimes it's sooner in the conversation you think. And really, sometimes I say we less of a missing problem than a relationship problem. And the more we can build that dialogue there. So I think my experience, the area that we're trying with new technologies, particularly our relationship with Facebook, and I'm Praveen here, is really at how can we be more receptive and engaging, and various out there, what is working, what is having impact. But also, I think to be not just with the users, but I think we also, what I love about partnership with Facebook, I'm not going to, we may have some health insights, but I'm not for some of the technology area. I've learned a lot about technology since the first computer in the classroom, but more user end. But it's about shared expertise. And when it comes to policies, I want to be recommending to Facebook policy their technology capacity, for instance. That's where I think we have to, again, it's not with each of these, bring our relevant expertise to the table. But on the misinformation thing, I really think we also have to understand why people are believing some of the things they do, because there's accidental misinformation that's getting spread, but then there's also intentional. So we have to look at also what's the motive behind it.
Yes, Heidi, thank you for that. It really is a question of what's driving this, and I hope we can come back to that in the discussion section of this plenary. Now, folks, I know we're having some issues with the video and audio. That's the joy, hey, of this last year, living in Zoom land and the various mobile and virtual meetings that we've had. So if we move to audio and you just see photos of us, that's why. So with that, let me turn to our next guest, who is an equally extraordinary person, Dr. Praveen Raja, who is the head of health partnerships at Facebook. And I don't think it's any understatement to say, Praveen, that you have really created a revolution inside the company in terms of the way you all partner with the global health community. We heard Andy talk about your work with the WHO. And I guess the question that we would really like to put to Facebook is, can you talk a bit about the experience, priorities, and indeed your future work, where using all the products and assets that Facebook has, you can move to really affecting behavior change and encouraging users of Facebook to make the kind of decisions that, from a public health perspective, make so much sense, and which those of us involved in public health advocacy and communications for far too long have not really had too much success in effecting.
Thank you so much, Ben, and thanks to everyone who organized this great conference. I think it's just, when I look at the series of topics for this conference, it's just so amazing. And I'm happy that we're able to do these kinds of have these conversations, especially during a pandemic and doing it virtually. I came to Facebook, just as a bit of a personal story. I came to Facebook at the beginning of the year, just before the pandemic hit. So nearly all the work that I've been engaged in and our teams have collectively been engaged in has to do with our pandemic response. And it has touched a lot of lives in the process and has involved a lot of collaborations, even with the people on this panel like Andy and Heidi, et cetera, are really close partners. I want to just frame for you the opportunity that we have and the ways in which we've been realizing that opportunity. Just on a personal level, I came to Facebook because when you think about the opportunity to actually reach people and to impact health, the opportunity was huge. Facebook is not just one entity. For people who may not know, it's actually a collection of a number of different technologies and apps and platforms. For example, Facebook Inc. also has the Facebook app, WhatsApp, Instagram, Messenger, all are part of Facebook. And collectively, we have about 3 billion people on the platform. So that's a huge opportunity to reach people. But the opportunity that brought me to Facebook was to consider how to reach those people to actually advance health. And that, I think, is the central question. And during the pandemic, we have tried to answer that question in two different ways. First, we have partnered with a lot of public health organizations and academic collaborators, NGOs across the spectrum as partners to really bring to advance that health. And that's because Facebook is actually a platform. We're not a health organization. It's a platform. It's a social media company. It is a way to reach people and to help people. Our mission is to bring people and communities together. But in this case, we want to do that with regard to health. So our efforts during the pandemic have focused on two different buckets of activities. If I can just synthesize it, it's a lot of activities, but I'll try to highlight two of them. One is around health messaging. Early on in the COVID cycle, when I first came to Facebook, me and my teams reached out to partners such as the CDC in the US, World Health Organization, UN, UNICEF, American Red Cross, and the International Federation of the Red Cross, partners like that. And we simply asked them how we could help. And what they said is, well, the most important thing we can do is to send preventive health messages out to keep people and the population safe. So we've been engaged in that effort in a highly scaled manner. We announced somewhere in July, and I've not looked at numbers since then. By then, we had already reached 2 billion people via our products and also by partner channels. So it's a pretty huge number, the opportunity we've had to reach people with these preventive health messages. And then along this timeline, we've also covered a lot of topics, things like hand hygiene, mask wearing, social distancing. And now we're moving increasingly to address the next big topic to control this pandemic, which are vaccines. So we've been working in that to advance that effort, and I can describe that a bit. But before I do so, I'll just highlight the other big activity we've been engaged in, and that is to focus on generating data to help inform public health efforts and also to help inform public health decisions. So if you think of yourself as a county, state, national public health official or public health agency, you're trying to always understand, like, what is one of the initial questions are, what's the actual spread of the disease in the population? What's the prevalence? What's the incidence, et cetera? But that was not known because there was not enough testing. And in many cases, there isn't enough testing even now. So we were able to think about how Facebook might help in that effort. And we launched one of the largest surveys in the world. And we think that it's actually the beginnings of a global disease surveillance system. We partnered with the Carnegie Mellon in the US and also University of Maryland for global data, but we essentially launched a household survey globally in over 200 countries. And it's a daily survey, and we ask households at a certain rate if there's anyone in their families who have COVID-like symptoms. And we also try to capture things like preventive health behaviors they may be engaged in, like mask wearing. And that data has turned out to be one of the largest data sets that's available to understand what's happening at the level of households in terms of symptoms. and also understand some of the preventive health behaviors. And they inform many of our partners, like the IHME uses this data for their modeling and forecasting efforts. So that opportunity and ability to generate data at scale by leveraging technology and social media has been hugely valuable. The second data generation activity has been to actually think about preventive health behavior in a deeper way, because obviously absent a vaccine, our ability to move people and populations to focus on adopting preventive health behaviors has been of key importance. So we launched a survey in partnership with MIT and Johns Hopkins in over 67 countries. And we're doing that in waves of every 3 or 4 weeks. And we're trying to understand to what extent do individuals practice preventive health behaviors, but it's actually much more than that. We try to understand, where do they turn to for information? What sources do they trust? What messengers actually have resonance with them? And then we also try to get their thoughts on what they think the social norms are in their environment, like what they see as the mandates in their environment, what they see as other people around them practicing preventive health behaviors, and to what extent they adopt it on their own. So collectively, those data are informing a lot of the public health decisions. So we've tried to focus in these two areas: health messaging and also in public health data generation. Last thing I'll mention is that we've been focusing increasingly on thinking about how we might help with driving vaccine acceptance, vaccine confidence, at the minimum vaccine education. So we're working on that topic right now, and we're partnering with a lot of public health agencies, the UN, UNICEF, WHO, CDC, Gavi, et cetera. We're trying to think about how we can all work together and take some collective actions to really inform people, bring people the right information about vaccines. Outside of misinformation, this is something that Heidi has taught us as well, that you look at people in terms of what questions they have. People really want to know. So there's people who are not going to accept vaccines. And then there are people who, in the middle, who might be vaccine hesitant. But what we call vaccine hesitancy, obviously I learned from Heidi, are people who actually may have genuine questions about safety, about efficacy, what it means to take it, what are the long-term implications, how much it protects, and so on and so forth. We're trying to work with Heidi to get more definition around those questions, understand the sentiment that people have, and then providing them with the right knowledge and information that might actually, over time, move them to the right actions and behavior. So those are some of our efforts. Ben, thank you so much.
Thank you so much, Praveen. Now, our next speaker is Rachel Sibandi. And Rachel, you are the program director for data development at Dial. And I guess a two-part question, one you're expecting, maybe one you're not. The first part is, could you just tell us a little bit about Dial and what it does? And then what I'd really love to do is to ask you about your country experience, particularly in Malawi, and how working with government and mobile network operators has enabled you to maximize collaboration on digital and data use to reach those populations perhaps most at risk and most in need of information in these crazy times.
Thank you very much, Ben. It's a pleasure to be here today. So first of all, the Digital Impact Alliance is a unit within the United Nations Foundation. When it was set up, we were primarily tasked by our group of donors, including USAID, Bill and Melinda Gates Foundation, and CEDA at the time. Currently, we've also been joined by FCDO to demonstrate the potential that non-traditional data, in particular data from mobile network operators, could become useful in helping to enhance decision-making by governments in reaching the people that need the most. It could be to understand population movement patterns of people in a safe and responsible way, to enhance decision-making for where to place new health facilities, for example, or for where to actually reach people that have been affected by natural disasters, as another example, or to enhance immunization outcomes by reaching populations that are nomadic in nature, and maybe they have children that are not accessing immunization in some regions. So that's what we were tasked to do as a Digital Impact Alliance in terms of enhancing the utilization of data for decision-making. Now, during the COVID-19 pandemic, we've had to shift.
Well, seems as if we have lost Rachel for the moment. I know that our tech folk will work to get her back. How about we move on to the next guest, and perhaps we can reconnect with Rachel later in the session. So that's basically your heads up, Hema, that I'm coming to you now. Now, Hema Budhi is, I think, one of the, if you don't mind me saying this, one of the sheroes of the tech global health environment, particularly here in the Bay Area. You've done some extraordinary things. And, you know, you're at Google Geo, and it's really integral to the way in which many of us lead our lives, both individually and I certainly know as members of community organizations. And, you know, so it would be great if you could tell us a little bit about your role and the approach that GEO has taken to connect people to health services and positive public health messaging.
Thank you, Ben. It's an honor to be on this panel and in this company, and to a large extent take this work forward through this partnership of public, private, tech, humanitarian, and academic organizations. Ben, I think you'll agree with me that this is probably the longest short year of all our lives. And a big shout out to Andy and the work from WHO and the work that we've done in partnering with WHO and putting out information that brings authoritative and trusted content to millions of people around the world. I'm going to focus today my remarks on Google Geo, or more colloquially, maps. Maps that help us move around, even in a year like 2020 where there is not a lot of moving around. A little bit of context. Google has provided maps for more than 220 countries and territories, and we cover about 200 million places as places on the map itself. Now, creating a map is hard because the physical world changes every second, and to keep this information updated is both a science and a terrific operational challenge. Now, in the world of COVID, we've each of us felt how this has changed, how we shop, eat, do our groceries, move around in the world. And just as a reflection, the amount of change that COVID has brought to Google Maps just alone, if you compare, is if you look at March and April of this year, the number of changes we saw in terms of temporary and permanent closures on maps exceeded most of what we saw in 2019. Now, how would maps play a role in the world of COVID? I wanted to give you a few concrete examples, and something that I'm seriously proud of having contributed to. The first one, we now show more than 17,000 COVID-19 testing centers across 20 countries and all 50 US states within Google Maps and search. And as we continue to get more authoritative information, we will continue to expand this feature. We also saw that lockdowns significantly impact people's ability to meet even basic needs. As an example, in India, during the early months of COVID in March and April, where millions of migrants were on foot trying to go back to their villages without access to food and places to stay, we worked with the government of India and added 11,500 shelters in more than 700 cities. At the height of the crisis, we were seeing about 200,000 searches every day for shelters in India. And more recently, this is something that any one of you, just open up Google Maps and you'll see this today. We introduced a COVID layer in Google Maps for you to see the most up-to-date, authoritative information as to how many new COVID cases have been detected in that area or your area, and if there is a change, a rise or a decline. In fact, very soon, you'll also be able to see all-time detected COVID cases and the trends, as well as quick links to trusted COVID-19 resources. Now, showcasing this information is possible only when we can work with organizations such as World Health Organization, Johns Hopkins University, the New York Times, many government health ministries, and state and local health agencies. Since we launched this code layer only in September, just about like 6 weeks ago, more than 10 million people have used it to staying informed. Now, these are only a few of the examples. We've added close to 250 different features and improvements in Google Maps, be it to you as citizens who are moving around, be it to small businesses who need to adapt, or be it for academics and governments who are trying to create new policies. Today, my remarks, while I'm focusing on Google Maps, Alphabet as a institution, and the various Google properties, search, YouTube, I think there's tremendous contribution in terms of how we can bring the most helpful information to people in the time of need. I'm really looking forward to understanding more as to where the rest of our panelists are thinking about going forward and opportunities to collaborate together. With that, Ben, I'm going to give this back to you and see where you take us next.
Thank you very much, Hema, and really appreciated your comments. And I'll just put a pitch for the Oakland organization CalPEP that has provided HIV, COVID, and food and hygiene services to the homeless in the East Bay, and has really relied on Google Maps to help people connect with services. So I've seen firsthand the wonderful work you are doing. So with that, can we go to the gallery view? And I want to see if Rachel is back with us. And Rachel, if we can just try and give you an opportunity to talk a little bit more about what you've been able to do in Malawi.
Thank you, Ben. So I did cut earlier, but I wanted to share that we've been working with the mobile network operators in Malawi to leverage data from the telcos to generate insights on population movement patterns of people in the short term, long term, and seasonally during the COVID-19 pandemic, which has been utilized by the Ministry of Health there to make better decisions in anticipation of where to anticipate high COVID-19 hotspots, probably because people are moving from a high COVID-19 hotspot area to maybe an area where there aren't as many cases. So the government has been able to make better decisions in anticipation of potential disease spreading locations just by leveraging the power of this form of non-traditional data from mobile network operators in combination with other data sets such as disease burden, the age of people that are high at risk, or those with comorbidities that put them at risk, and also looking into socioeconomic vulnerability indicators such as access to water and access to sanitary facilities. But in closing, Ben, what I wanted to intimate is that we've demonstrated the power of combining traditional digital data sets and non-traditional data from entities like mobile network operators in helping governments to make better decisions in a safe and responsible way to reach the people that need the most and to anticipate the spread of a pandemic like COVID-19 in real time. Thank you.
Thank you, Rachel. And just wonderful we were able to get you back. And I think that's a really neat setup for the next part of our discussion, which is really to everyone. And we haven't really been coming at this from a vaccine. There have been epidemics, really, I guess, all throughout human history, but particularly since the mid-'80s. I'm thinking of HIV of SARS, MERS, and of course Ebola. And perhaps Heidi, I could start with you. What do you think the lessons learned that we have had from these other epidemics, and particularly HIV, that have helped forge these creative new partnerships that the panel were talking about?
Well, certainly, Ben and you and I were at the joined at the hip in terms of the HIV response, and really, it was a lot of community work. I mean, one of the challenges with the vaccine issue, it becomes very vaccine specific. And I think with HIV, we didn't have vaccines. We still don't, actually, nearly 40 years later, or drugs in the beginning, and all we had was behavioral. And so we engaged everyone. I mean, from miners to truck drivers to hairdressers to you name it. It was a totally society-wide engagement. And I think in the context of COVID, I mean, that's going to be what makes the difference, is that we find different and a mix of partners beyond and importantly including, of course, the traditional and needed members and collaborators.
Thank you. And maybe I could put the question to you, Praveen, as well. I mean, you talked in your opening remarks about the importance of, let's say, non-traditional partnerships, and certainly for many community and NGO organizations, social networks have been key to us reaching the clients we serve and the communities that we're a part of. How have partnerships helped you do your work more effectively?
Yeah, Ben, thank you for the question, and also Heidi, thank you for your remarks. I think that we have a unique opportunity. There's obviously the communication that is needed to help inform people and give them a real education on the topics they're interested in, help answer the questions that are burning in their mind, and to actually help them make the right decisions for themselves in terms of behavioral actions, I think are very key. But we are learning that the messages can't be just generic, right? It has to actually have meaning for a person. It has to be from a trusted source. It has to be hopefully something that's local in context that they can relate to, and then something that's fair, balanced, and scientific, so we know it's neutral and not politicized or polarized, and then helping over a period of time for people to make the right decisions. To do that, though, we need a lot of partnerships, to answer your questions, and partnerships have to be at a number of different levels. We in technology are a platform, and I think this is something we have today that we didn't have in previous pandemics, and not even when we had the HIV crisis. I think we have a unique opportunity to bring technology here in a big way. So I'll give you a couple of examples of how this is working that is actually having impact. We're noticing that on the ground across the world, there are NGOs and smaller nonprofit organizations and other players who actually have really important messages. They have the local context, they have the local trusted messengers, and they know how to reach the people in their environment, but they actually are doing it in old world kind of ways. They're not on any technology platform. We're finding that don't even have a presence on Facebook, like even an organizational page. So we did a little experiment, for example, for World Immunization Week. We partnered with Gavi and with Gates to identify about 40 NGOs that are in that kind of a state. So we brought them in as partners to say, okay, if they didn't have a Facebook presence, we helped them gain a Facebook presence. And then we put them through a bit of a training program to understand how to be effective on social media, and then also help them develop messages and gave them free ad credits to run public health messages on the platform. And then when these campaigns ran as part of World Immunization Week, we started getting experiences and results, and they were extremely gratifying. We got back unsolicited type of testimonials of these organizations saying how much they were able to improve their reach and to what extent they were able to gain traction with their users and how much their messages had impact. So we feel like there's power in bringing organizations like that, health organizations, global health, public health organizations into this space and providing them with all that they need to be successful. So we're continuing to evolve our systems to create the right platform to orchestrate messages in that kind of a way that engenders trust and helps people get the right messages that's science and fair-based, that's fair and also from trusted sources, and then move them to behavior change. So we're trying to do that in newer and newer ways by more and more collaborations across the spectrum with global health organizations, such as we work closely with Andy, we work closely with Heidi. So it's not just the large global public health organizations, but it's also the little organizations, the nonprofits, the NGOs.
Thank you, Praveen. And let me just remind our audience that in the Q&A, you can submit questions to us, which I can put to our esteemed panel. So fire away, get those fingers going on the keyboard. And in the meantime, Andy, let me come to you about this question of partnerships, because, when we thought of the WHO, it's a very traditional Geneva-based organization with, ministers of health and a very established public health way of doing things. And yet you guys have really revolutionized the way in which you have thought about health and thought about engaging new technology partners. Can you explain a bit about your thinking there and how this year has been such a dramatic change in the way you're approaching behavior change communication?
Yeah, thanks. That's first of all, thank you for the compliment about the World Health Organization, the way we're trying to tackle this pandemic through innovative communications. I still think we've got a long way to go, but I think we've certainly tested the waters and tried new things and reached billions of people. And the key word there is billions. We're really reaching billions and billions of people. One of the key changes within WHO was the arrival of Dr. Tedros, who is our Director General. And I remember hearing him very early on saying public health hasn't changed for 70 years, but just about every single other industry has. What can we do about that? Why don't we change these things? We're not able to, eradicate wild polio. Why is that? We can get things right down. We've only eradicated one disease ever in history of man. We should be able to do others, right? And we can tackle these things. And so what he said was, we have to think outside the box. We have to start shaking up public health. We have to do things differently. And he said, if we don't try, we have already failed. So go out and try. And if you fail, well, we failed, but at least we didn't stand there and watch. We have to have a no regrets policy, especially in this case. Our work, we were able to hit the ground very quickly because already 2 years ago, we started collaborations with the tech industry. We launched our physical activity guidelines on Google Fit, along with the American Heart Association, which also use our guidelines. And that was our first foray into working with the digital private sector. And since then, we've started to build up momentum. We already had working relationships, obviously, with Google and Facebook and Amazon and many other tech industries, not only in America, but also TikTok and companies in South America and Africa. And so when the public health emergency of international concern was declared in January, basically I jumped on a plane, got into the Bay Area and convened a meeting of the tech industry of the Bay Area and did the same again in Seattle and just said, this is going to be a big one, guys. We need to get ready. We need to collaborate. What I was really pleased to see was the absolute solidarity within that industry. But it's clear that this is an all of society problem. And I think that one of the things that we need to do is understand as individuals, it's not just the role of companies, but as individuals, we also have a responsibility. We have to think and we have to educate people as to when to share information. We can't just blame the platforms because the content's on there. Somebody's uploaded it, right? And somebody's sharing it. And the nature of it is that the more it's shared, the more viral it goes. So it's a self-fulfilling prophecy. Human nature is built around sharing bad news because it saves lives. So if 300 years ago I was down foraging by a river and I would come up to the village and I would say, well, don't go down to the river at the moment because there's a big bear, everyone within the village would be told that because it saves lives. If I came up and said, oh, there's some lovely flowers at the moment, maybe one or two people would talk to each other. So it's human nature to share bad news or inflammatory news or scary news, and we all get caught up in the moment. I myself, as somebody who's fighting infodemics, got caught up in the moment once during this pandemic where I saw something that was very relevant to me, that seemed extremely pertinent to our health situation in my region, and I fell for it. And I shared it with my family group, and I said, oh my God, let's have a look at this. Then I took a deep breath, and I thought, I better check the facts. It was all wrong. It was all nonsense. So I think we all have to, as a whole of society, take responsibility for some of our actions. We also have to start thinking as a digital industry how we can improve these services and think less about going viral quickly. And I'll give you an analogy of what I mean. When I travel, I don't want to take the fastest plane somewhere. I want to take the fastest plane that gets me there safely. And that's really key, safely. I would like the tech industry to step into that space and give the user journey as safe as possible, even if that means that things won't take off as quickly. So we're going to have to trade speed and volume for safety and common sense. And that's, I think, is a difficult one to do. But I think WHO has tried many things to get out there in people's lives. I don't think WHO should be building tech platforms. I think that WHO should be doing good content, and we should have partners in the tech industry, in the public sector, across all of society to help us get those messages in the right form. And what Praveen said is very pertinent. It's fine to say wash your hands, right, to help combat COVID-19. But I mean, we've all heard it so many times, we're going deaf and blind, right? It doesn't make any difference. We don't hear it anymore. We all know we have to do it. If not, we've been completely disconnected. So we have to do all these health measures to protect ourselves. But at the same time, we don't listen to them anymore. So we have to become innovative in either the way we target people. So I'm thinking, how do we target the female under 30 live stream gamer? How do we do that? Because when she sees that message, she'll say, oh, that's for me. I'm definitely reading that. Or surprise people in where we appear. And so that's where, our relationship with even companies like Tinder, we've been able to get health messages to Tinder, through Tinder users, while they're swiping, looking for their next contact or date, to talk about health messages and, stay informed, learn about your safety measures, learn about these things. So I think that we have to innovate and we have to try, or we've already failed. Back to you.
You, Andy. And we've got questions coming on in, so that is wonderful. And there's one I'd really love to start with. And Rachel, I'm going to put this to you first of all, and then ask others to comment on it. And it's a question from Sky Gilbert. What impact do you think COVID-19 will have on the digital divide? Do you see a role for social media to reach across the divide, perhaps through super user intermediaries like community health workers?
Thanks, Ben. So I'll speak to that from the context of where I work, the communities that we work with, majority of whom do not have access to mobile phones. They're still, haven't been breached by the digital divide. And if they do, if you look at the statistics, majority are not able to access, the internet. I think the closest they get to accessing a mobile phone platform is either through USSD or indeed through interactive IVR, through voice. And so I would say, yes, there's potential for social media to bridge the digital divide, but at the same time, we also have to be considerate of the fact that there are populations out there that are marginalized and they have very little access to the internet or no access at all. And not until we are able to enhance access to the internet, enhancing digital skills, can we talk about social media in itself being able to bridge the digital divide to individuals in themselves. However, in the meantime, leveraging platforms like USSD, for example, or IVR, which does cater for populations that are not as literate, would be ideal. Lastly, also to mention that with social media, there's an opportunity there to leverage community health workers or health surveillance assistants at community level who can be the bridge of carrying information that is available from social media to the communities that they serve. So those are some of the mechanisms in which perhaps we can bridge that digital divide in leverage social forms and other mobile platforms like USSD and IVR. Thank you.
Lovely. Thank you, Rachel. Well, we've got a question that's coming in from one of our partners for this session, the Bay Area Global Health Alliance, which is a group of companies in the tech and biotech and other fields, academics and nonprofits, all in the Bay Area, committed to improving the health of people around the world. And Sarah Anderson, the Alliance's executive director, reminds me that this is also an event that we're doing in partnership with the WHO to help inform their work. And she also is very interested to know about, well, what does the future look like? What are the three things that you think can help mobilize the use of new technologies, of new kinds of engagement that we see through social networks to enhance behavior change? And maybe, Hema, I can start with you and ask, as you sort of look into the crystal ball, what do you see coming down the pike?
Thanks, Van. First of all, even in this large forum, I have to say hi to my good friend Sky Gilbert for asking the previous question. Sky, I hope you're doing well and doing good for the world as you always do. Back to your question, Ben. What are the things that are on my mind when I look out? And I have to say, I put on a lens of what can be done both in the short run and what can sustain and are durable principles, values, products that we build out and approaches. First thing this year has taught us, especially in combating something like a pandemic, the collaboration between tech and public sector, the intersection between technology and social impact. This was a phenomenal year for showing the power of partnership and how multiple sectors come together for the greater good. I really hope that this continues. There is a role that authoritative, credible, trusted, actionable, timely information plays, and I think, as Andy called out, content. And then there's a role that platform providers have in bringing this information in most simple and helpful ways to people. So I think the second thing that I would call out is, in addition to authoritative content, timely, reliable, and fresh information in ways that are understandable and easily accessible, regardless of your access to digital means, as the previous question showed, is another trend that I'm going to look forward to. Since we have actually an esteemed panel and short time, how about I actually hand this to Ben, you or Praveen, to see if there are more answers to this?
Well, thank you, Hema. And as we're coming up to the end of the hour and the end of the session, perhaps I can use this moment to get other panelists just to offer very briefly their thoughts about what the future looks like as a way of wrapping this session up. And maybe, Andy, I can start with you.
Delighted to. Very quickly, everything we're doing on COVID, we're planning for the future. This has to we have to use this COVID pandemic as a catalyst for change. We have to build foundations for the future. Everything we're doing now, we have to start hitting bigger health issues in the future. So let's keep that momentum going. Very on a personal level, the future, I hope that this will be a catalyst for change and that we'll value doctors and nurses more, and maybe the entertainment and football players a little bit less, but that's my own personal view. Over to you.
Heidi, your thoughts?
Well, I just, one, it's been a real honor to be on this panel. It's such a great group of people and from the different perspectives. I hope that we use this opportunity to really, as Andy said, as a catalyst for change. Every crisis is an opportunity. I've seen tremendous altruism. I mean, I think there's a lot of stress in the world, a lot of other things, but I hope that in the future that we're better, the kind of altruism I've seen at a local level with people helping those who had to be locked down, bringing them food. I mean, things we've seen also even in our vaccine surveys, people are more willing to take this vaccine, which I was happy to see, if it's for other people than for themselves. That to me was it was a great day in this month when I saw the results of that global survey. It was a moment of I hope we can hold on to this moment and care more about what we're doing and what it does for other people.
Thanks, Heidi. Rachel, final thoughts from you? What does the future look like?
For me, the future points to a future where we will be more proactive in responding to similar pandemics than being reactive, where we can learn from what has worked well today to replicate those lessons into the future, and that there can be more public-private partnerships built and leveraged to fight and deal with this sort of pandemics in the future. Thank you.
Thanks, Rachel. Praveen, you get the last word. What does the future look like to you?
Don't have a crystal ball, Ben, but I think that I can only tell you what I aspire for. I think we should work together as a global community to bring more people into technology platforms. If anything, we have seen the power of technology and social media platforms affecting people's lives and health, especially when people are in lockdowns and can't have access to all the physical universe that they're navigating in. I think Facebook has had things like the Free Basics program and other ways to bring more people online. So that, I think, bringing more people together is important. But even more than bringing people together, I think we have to build communities. And I think that's really important. We're experimenting and doing that more and more in health with the concept of Facebook health communities or health groups. So you could bring any group of people together, community health workers or patients or doctors or other kinds of people. And we literally have tens of thousands of these groups on Facebook. But that is a notion of community that can actually grow to really think about how we can understand the needs of those communities. How can we bring into them certain services, whether it's information from trusted sources or other kinds of things, I think are important. We've seen with engagement like that, elevating science, elevating trusted sources, and giving people what they need through these platforms, I think can solve for a lot of health challenges. So that's a lot of what I look forward to. And I think we have a tremendous opportunity, but it can only work through partnerships. Facebook and other platforms are just really that. We're platforms, but needs a huge partnership on the ground with local organization and with all the agencies. So this coming together of tech and public health, I think, is the key development that's sparking a lot of advancement right now in public health during the pandemic.
Thank you, Praveen. And I think if there's one underlying message that all of our panelists have reiterated, it is that collaboration between public health and tech is going to be so key in this next phase of human evolution, in this age, as so many of us now realize, is the age of pandemics preparation. So I know we had a lot of questions that we didn't get time for, but I think that speaks to the huge excitement about this subject and where we go forward with these kinds of partnerships. So it just remains for me to thank Andy, to thank Heidi, Praveen, Rachel, and Hema. Thank you so much for your time today, and thank you to the forum for giving us this opportunity. Have a great day, everybody.